Welcome to South Dakota Department of Health media briefing. As a reminder, please mute your phones. Today we are joined in the room by Secretary of Health Kim Molson-Risden, State Epidemiologist Dr. Josh Clayton, and South Dakota Department of Health Communications Director Daniel Buccielli. At this time, I will turn it over to Daniel.
Thank you, Rebecca, and good morning, everyone. As the Department of Health, we thrive on providing all South Dakotans the latest updates on COVID-19 as it becomes available. And to that end, here's the latest statewide COVID-19 information. New confirmed cases, 192. New probable cases, 72. Active infections, 2,522. Recovered cases, 113,302. Currently hospitalized, 104. Total tests performed, 1,066,002 tests. On total unique persons tested, 444,576, with 117,759 positive cases and 326,817 negative persons. We continue using the RT-PCR positivity rates, since that measure is being used by the CDC, as well as CMS for nursing home and long-term care facility reopening plans. That last 7-day number, as of this morning, is 9.7%. Additionally, 410,502 doses have been administered to 252,751 state residents. This translates to 43% of the state population having received at least one dose. All of this provisional data can be found on our COVID-19 dashboard found at DOH.sd.gov. And as a reminder, next press briefing will be held on Wednesday, April 14th. I will now turn it over to our state epidemiologist, Dr. Joshua Clayton.
Thank you, Daniel, for the number updates today. Just wanted to start by providing a little update on our dashboard. So the COVID-19 dashboard includes now the information for individuals by race. So that has been added to the vaccine tab within the COVID-19 dashboard. One thing I did want to note is that COVID-19 vaccines are provided by the VA and IHS are not reported to the South Dakota Department of Health, which will decrease the percentage of minority race and ethnicity represented in the state when you compare that to the South Dakota population. So what you'll see when you take a look at that tab is that we have 87% of our population vaccinated being of white race, and only 1.5% showing American Indian race. So that is falsely lower because, again, the IHS facilities that are vaccinating have a focus of providing vaccines specifically to our American Indian population within the state. A couple of other quick updates. Just wanted to provide a variant update in the state. So that we have, as of last week, identified 3 different variants. So we have the B117 variant that was identified, and in total we have 14 cases. And the location of those 14 cases includes Brookings, Lyman, Minnehaha, and Pennington County. We have also identified 2 new variants, the B1351. There was a single case that was identified among a Brookings County resident, and the B1429 variant, which 5 cases were identified among Roberts County residents. Now, what those variants mean is that we want folks to make sure that they are taking precautions. We know that some of the variants, and specifically the variants that we have identified in the state, come with increased risk of transmission of the variant, as well as concerns for hospitalization and seeing increased severe illness. In addition, which is maybe accounted for by the variants, we are seeing increasing cases within the state. So over the past week, which includes March 21st through the 27th, we have seen an average of 198 cases per day, which is a 13% increase compared to the 176 cases per day we saw last week, March 14th through the 20th. And similarly, we have seen the median number of individuals who are currently hospitalized increased by about 6%, from 68 2 weeks ago to 72 just last week. Nationally, the individuals who are being hospitalized are younger, and so the data that we have for South Dakota also reflects that. Hospitalizations among those aged 80 years of age and older decreased by 46%, from 70 to 38 hospitalizations, comparing data from March 14th through the 28th and data from February 14th through the 28th, so a 2-week period at the end of February and March, respectively. Now, during that same time, we saw hospitalizations increase by about 42% for individuals in the 40 to 49-year age category. That was an increase from 24 hospitalizations in February to 34 hospitalizations at the end of March. So we do want to stress that continued prevention against transmission of COVID-19 should include making sure that you're physically distancing, wearing a mask when that is not possible, avoiding crowds, get vaccinated when it is your turn, washing your hands, and practice cough etiquette, and of course, staying at home when you're sick. 2 other quick updates I wanted to provide. The recent study did show the benefits of vaccination among pregnant and lactating women. COVID-19 is safe and effective for the general population, and now there has been a study that has shown it is safe and effective for pregnant and lactating women. The same level of antibody was produced when you compare pregnant and lactating women versus non-pregnant women. And specifically, antibody levels were higher for women who were vaccinated versus those who developed COVID-19 infection during their pregnancy. So one of the benefits that was identified in the study is that babies who are born to vaccinated mothers, the antibodies that protect the baby were passed from the mother to the child while in the womb, and also from mom to baby through breast milk. So the last update that I wanted to provide is that for vaccination, South Dakota continues to be a vaccine leader among states. When we look at our older adult population of those 65 years of age and older, South Dakota's percentage coverage was 83.6% compared to 72.1% that had 1-dose coverage for the United States. Similarly, when we look at the total adult population, 18 years of age and older, where the South Dakota population was at a 1-dose coverage of 44.9% compared to 35.9% for the rest of the United States. So with that, I will turn it over to Secretary of Health, Kim Malcolm-Reisen.
Thank you, Dr. Clayton and Daniel. Good morning to everybody who's joining us. Before we open it up to questions, there are a couple of things I'd like to share with you. So since we last spoke, over 410,000 South Dakotans have received their COVID-19 vaccine. That's almost 95,000 residents in the last 2 weeks. As Daniel mentioned, almost 43% of our state has received 1 dose, and over a quarter of our population, or 28%, has fully completed their vaccination series. We do remain a leader in those efforts, and with the expected increase in allocation that we expect for April, we expect these numbers obviously to continue to rise, and we're very grateful for that. The allocation for this week for first doses is 27,340. As of this point, right now, the allocation for next week is 32,900 doses. And of course, as a reminder, this does not include the supply that's being distributed by the Indian Health Service, the Veterans Administration, or by the federal retail pharmacy programs located across the state. As an aside, we do expect to see more of those pharmacies getting federal allocation of vaccine in the coming weeks as well. CDC studies have shown that the COVID-19 vaccines are safe and effective, and in addition to this, The science is showing us that the fully vaccinated individuals are 90% less likely to get infected by the virus. As well, all of the approved vaccines are 100% effective at preventing COVID-19 hospitalizations and deaths. And so thank you for helping us get the word out about those numbers, because they really tell the story about why to become vaccinated. I do, before we get back to the COVID piece, I do want to make a pitch about childhood vaccinations in general. We know that vaccines are very important for the health of our children, and we have seen a drop in overall childhood vaccine take-up in the years 2020 and 2021 compared to 2019. So we've seen a 14% drop overall, including a 20% drop in vaccine administration for measles. And so really want to encourage parents to talk to their child's provider, see where they're at with their regular childhood vaccines, and get their kids caught up. That's just a core public health function, and we want to make sure that, as we work through COVID, that we're still paying attention to those childhood diseases, which, again, can be deadly or very, very severe for children. Back to COVID, you should all be aware, hopefully, that we have very good news in that starting next week, we will be moving to phase 2. So Governor Noem just announced that earlier this morning. So starting April 5th, we will be seeing vaccines available to all eligible 16 and plus population across the state. So this is definitely, the result of the hard work of so many people working to vaccinate folks in our state. And I just want to echo what Governor Noem said in terms of being grateful towards our medical workers, the state healthcare systems, pharmacies across the state, and our staff here at DOH, and then also South Dakotans who are stepping up to be vaccinated. So I'll just stop by encouraging everybody to check out the covid.sd.gov or the doh.sd.gov website to learn where people can sign up for vaccines.
Okay. Thank you, Madam Secretary and Dr. Clayton. At this time, we will open the floor for questions. Could you please identify yourself, your media outlet, and then ask your question? Who would like to go first?
Tom Hanson from Kello
News Radio.
I heard Tom.
Yes. Now that we're getting the vaccine to just about everybody, is there a concern about vaccine hesitancy?
Well, Tom, this is Secretary Malcolm Risden. Thank you for asking about that. That remains an issue that we continue to watch very, very closely. And as we, are able to get vaccines to folks that are ready and willing, we will also be continuing to do outreach with folks who have been eligible and for whatever reason did not take up the vaccine. And so that is an issue that we will continue to work on. Sometimes people just need a little bit more time to think about it and see the experience of their friends and neighbors and family members. But it is something that we will continue to work on so that folks have the information they need to choose to be vaccinated.
Next question, please.
JP Callaway.
This is Stephen Gross from JP.
I heard JP.
Yes, thank you very much. We were watching the trends going up with increasing numbers of new cases. Are any of these possibly tied to the recent boys and girls state basketball tournaments in the past couple of weeks?
So this is Dr. Clayton, and we've not specifically identified, cases resulting from attendance at the tournaments. What I would say is that, we are seeing a younger population impacted, but the cases within our school-age children has not changed in recent weeks.
Okay.
Thank you.
I believe our next question was from Stephen Gross with DAP.
Yeah, thanks. We're kind of seeing competing trends in some ways in terms of more and more people getting vaccinated, but then also a bit of an uptick in cases. I'm wondering, with the news that vaccines will be opened up next week. How are you kind of cautioning people to continue to remain vigilant and take precautions, even when we would all be tempted to kind of be done with the pandemic in some ways?
Well, Stephen, you raise a good point, and that is the need for people to continue to take precautions. There has been some guidance from the CDC about what fully vaccinated people can do that looks different than what the prior guidance had been, but until people are fully vaccinated, and even after they're fully vaccinated, and if they're coming into contact with folks who are not, people still need to take precautions. And so that social distancing, physical distancing, washing your hands, wearing a mask, avoiding larger groups, especially indoors, those are all very relevant and things that we need to continue to do. I think if you've been watching the national picture at all, you'll see, some raising of the alarm bells from the CDC in terms of what they're seeing nationally, and really just a big push for people to kind of just hang in there for a few more months so that we can avoid unnecessary cases and more deaths.
Okay. Next question, please.
Keloland?
I have a question.
Ray from Keloland?
Go ahead, Ray.
Hi, yeah. When you talk about certain populations that might be hesitant, a lot of the vaccination process requires registering online. Have you identified any concerns or issues with people who might be hesitant or afraid or just not familiar with using the online process?
Well, certainly that is, part of our strategy includes helping folks that aren't able to use the online registration systems that our partners have as readily as others. And so we have our 800 number that people can call for assistance with that. Our vaccinating partners for phase 1 also have phone numbers that people can use if they need assistance with that. But again, as we continue to work through our plan, we will be working to provide information in a lot of different formats so that if the problem has been that a person can't use the internet well or access is limited, that they will certainly see other ways to access. And just as a reminder, the 800 number that people can call if they need help finding an appointment is 1-800-997-2888.
Next question, please.
John Winwood.
This is Stephen Gross from APGAN.
I heard John.
Thank you. This relates to a few questions mentioned a few minutes ago, in that we're seeing positive COVID cases, but the vaccination rates are going up. Is that completely tied to younger populations, or what are the statistics behind that?
Yeah, well, we are seeing younger populations hospitalized. We still see cases across the age spectrum. And so we do want to make sure that individuals, especially now as we're opening up vaccine to the entire population, the age 16 years of age and older, that some of those folks that have not been in the highest risk for hospitalization, but still were at risk for infection due to COVID-19, are able to get vaccinated and decrease, some of the increased number of cases that we're seeing. It's not been attributed to any one specific age group, the increase that we're seeing.
Next question, please.
This is Jonathan with the Argus Leader.
Go ahead.
Thank you. Hey, we've received a report that there was a kind of a cluster outbreak last week at an assisted living facility in Salem among residents and staff who had been vaccinated. I noticed last week there was also just a big statewide reported increase in long-term care positive cases. Do you have any additional information about that issue in Salem?
Yeah, so we are working with a single facility right now that was experiencing and has identified some COVID-19 illness among people who had been previously vaccinated. What I will say generally is that, it's not unknown for individuals to have what we call breakthrough disease, which is where, you know, you've had fully 2 doses, or so you have your full series, either the 2 doses of Pfizer, Moderna, or the single of the Johnson & Johnson, and have been at least 2 weeks after that last dose for individuals to potentially have illness. So the study level, you know, vaccine effectiveness is at 95% for both the Pfizer and Moderna vaccine. It's around 66% for the Johnson & Johnson vaccine. And, you know, we know that even with those very high vaccine effectiveness rates, that we will still see some cases. And so we are, because of the concern around variants, you know, we are collecting and trying to sequence the genomes of the virus that causes illness in those breakthrough cases, and we'll hope to have you know, additional information if we're identifying variants within specific populations.
As a follow, is there a concern that the vaccines maybe just I mean, this is a cluster or a group of people. Is there a concern that maybe they weren't administered properly?
I would not consider it a lack of, you know, vaccination adherence, you know, or temperature range issues or anything like that that might lead to some concerns around the vaccine that was administered. We know that when we're talking about in any sort of institutional setting, you know, assisted living facilities, long-term care, and so on, that the virus is just more easily able to spread in some of those facilities, and that's why, you know, we want to number one, assess, you know, what might be at the root of the cases that we're seeing among those who are vaccinated. But at this point, I don't have any concerns about the vaccines that have been administered.
Okay. Next question, please.
This is Stephen Gross from the AP again.
Go ahead.
Yeah, I was wondering, with the opening up of vaccines to people over 16, how large is that group of people, and do you have any estimate on how long it will take to get all of those fully vaccinated?
Well, Stephen, I'll look to Josh for any estimates on the numbers of the population that we have left to vaccinate, but the length of time it will take to get through the population really does depend on the allocation of vaccines to the state. And again, that comes to both the state here at the Department of Health, that we then work with our partners across the state, as well as the federal retail pharmacy partners, which get a direct allocation from the federal government, and then entities such as the Indian Health Service and Veterans Administration, and who get their own allocation. So you know, we do anticipate that the allocations will be increasing in April, and possibly quite substantively. So we're hopeful that that will actually be the case, so that anybody that's you know, ready to get their shot will have access to that.
And the population in total in South Dakota for those who are aged 16 years of age and older is about 689,981. And so, you know, when we're looking at getting to that population, obviously our vaccination efforts have, you know, gotten to a large number of people, specifically those that have been at the highest risk. So, you know, with 252,000 people that have already received vaccination, you know, we still have a large portion of that 16 and over population that are eligible for vaccine, and we'll be working to try and get to those folks and get them vaccinated. And obviously the number of the length of time that it takes to get through that population is going to be highly dependent on the amount of doses that we're receiving in the state.
Okay. We have time for one more question. Can I please have the last question?
Hi, Ray from Keloland, if no one else has anything.
Go ahead, Ray.
Okay, thank you. With relation to distribution for 16 and older, would you be encouraging mass vaccination clinics at this point, or will that be needed in order to get those folks vaccinated?
So, Ray, we anticipate seeing a lot of different kinds of opportunities available to people, and you know, in some communities there will be larger, you know, community-wide events, and in other communities it'll be very similar to what's happening now, where you might make an appointment with your local pharmacy and go in at your allotted time and get your shot. So we do think we'll see a number of different opportunities. Again, we do expect to see more, especially those at the federal retail pharmacy level, more access points coming online. So just kind of nationally, right now there's 17,000 pharmacies that are getting vaccine allocated to them across the country. That is slated to increase to 40,000 pharmacy locations across the country here in the next several weeks. So we think that there will be a lot of ways for people to get vaccines. Again, go to the covid.sd.gov website or the DOH.sd.gov website to see the latest information for local opportunities.
Okay. We would like to thank you for participating in today's media briefing, and we look forward to speaking with you again on March 17th. With any additional follow-up questions, please email covidmedia@state.sc.us, and this concludes our media briefing. Thank you.